similarly reflect those of Sonics Incorporated or CKRZ.
Welcome to CKRZ, everyone. Thank you so much for joining us today. And coming up next, as we had promised moments ago, we have an update for you from Six Nations Emergency Control Group. And joining us today is Six Nations Elected Chief, Mark Hill. Thank you for joining us, Mark.
Thanks for having me.
And you have a guest with you today.
Yes, our Director of Public Works, Mr. Michael Montour.
Excellent. So what do you have to share with us today?
So, Scano, Sego, and good afternoon, Six Nations members. I hope this broadcast finds everybody safe at home, healthy, and well rested. Today, I'm announcing the first confirmed appearance of the COVID-19 virus in Six Nations of the Grand River Territory. We received 2 positive test results yesterday. The Ohsweken Public Health has already begun tracing their steps and arranging testing for those they recently came into contact with. Both individuals began self-isolating immediately upon symptom development and testing, and continued to self-isolate until test results were communicated. They were monitored by public health throughout the duration of this time. The COVID-19 virus is here in Six Nations of the Grand River. The global death rate due to COVID-19 is 5%. This means if we do not reduce exposure to one another, the strong potential exists that 5 out of 100 people in Six Nations will die, and that's the reality. We know we couldn't stop it from being here. It's here. We can, however, stop it from spreading, because being around people is how it travels. Stay home, connect with your family and friends by phone or social media, and stop gathering in groups. In times like these, you hope for the best, but expect the worst. So we are ready for this. We have a plan, and we have the resources to control the spread of the virus within our territory. We've always known that our most important resources are our people and our knowledge. Now is the time to put those resources to work to contain the spread of COVID-19. This is truly going to be a community effort, and we need each and every one of us to work together to literally save lives. Through the SCODIN health campaign, we have been telling you the importance of taking every measure to stay at home with your immediate family. Elders, smokers, and people with pre-existing illnesses are at a much higher risk, so we really need to take this news seriously and work together to reduce the spread of the virus and, again, literally save lives. To the younger generation, you are not immune to this. We are hearing increases in younger generation contracting the virus and some even dying. Please stop gathering at parties and other large gatherings within the community and just stay home. We have been sharing important information on practicing physical and social distancing if you do have to go into the public, by staying at least 6 feet away from other people. We have been telling you to keep your homes and your bodies clean and disinfected, especially by washing your hands often for at least 20 seconds. We have been asking you to monitor yourself and others for symptoms of COVID-19, including a cough, fever, and difficult breathing, and to report any of those signs of those to the Ohsweken Public Health. We have been telling you to self-isolate if you're experiencing any symptoms by staying at home and away from others at all costs, and to tell, again, the Ohsweken Public Health Office for your safety measures. And again, we've been reminding the public that those who are self-isolating must do so for at least 14 days, because that's the time it takes for the human body to fight this virus. Now is the time for each and every one of us to begin putting the knowledge into action so we can literally again save lives in our community. And we need to be on guard and at the full attention, because the virus presents more of a threat to our most precious means, which is our elders. And it's not only regular citizens who have a role to play in this fight. We're calling on businesses to conduct themselves in a responsible way and do their fair share to protect the valued staff and customers. I'm also now urging all smoke shops to close immediately. As I drove into the radio station today, I just see nothing but lines up of congregation of people buying cigarettes. At this time, I like to question what is more important at this point: the sale of cigarettes and money, or the health and safety of our community? I also would like to ask for gas stations to suspend all tobacco sales for the time being, because again, this is a serious situation. Starting next week, we will be conducting checkpoints at our community entrances. This marks a drastic increase in our COVID-19 prevention efforts and also provides an opportunity for our frontline workers to monitor those entering and exiting our community. It's also a chance for us to continue to provide important information on our emergency measures and to share life-saving health and safety tips. We're also calling on similarly brave men and women to fill the positions of cleaners, personal support workers, registered practical nurses, respiratory therapists, registered nurse and paramedics and physicians. And we continue our call for the community volunteers we need to help provide food and other important and life-saving services. We appreciate the many businesses within our community who took the initiative to offer these essential services to our community members. If we all come together and do our part to protect our community and each other, we can control the spread of this virus and we can save lives. Ironically enough, the best way each community member can do their part is to stay home and avoid areas with numerous people. For important health and safety information, regular updates, and details of our emergency response measures, please visit sixnationscovid.ca or follow Six Nations COVID-19 updates on our Facebook and Twitter pages. Questions or concerns around your health and testing can be directed to the Six Nations COVID-19 Information and Assessment Center at 1-855-977-7737 or 226-446-9909. I want to end by sharing the good news that Fire Chief Miller's test came back negative and that he's already returned to the front lines of the fight. We hope you join him and the rest of us. I want to also remind everybody again, the true strength of a community in the face of adversity is how we protect our elders and most vulnerable. I also would like to end by saying that this virus doesn't choose a race, the color of your skin, or religion you believe in. It affects the entire human race. And by doing what we're doing by these extreme measures is not to deteriorate any relationships with our neighboring communities. It is simply to be able to protect each and every single one of us in Six Nations. Thank you, and Yahweh.
So I understand too that we're also changing the name of your recently announced project.
No, it's still called Project
Protect Our Community?
Protect.
Instead of our elders?
That's right. We have to go even further step.
Awesome. Well, it's kind of shocking to hear that people are still gathering in crowds. That's for certain.
Well, we need to, again, I realize and understand what the financial impacts are going to be. However, again, we're working diligently with both federal and provincial governments. We're looking at realigning our own resources. We're going to be looking to each of our community trusts, again, because we need to put every effort in front of us. And again, we want to be able to help the businesses that are going to be suffering and families that are also going to be suffering. But for now, we need to take this seriously, especially with the new 2 confirmed cases.
Indeed.
I just want to take this opportunity to pass this time over to the Director of Public Works, Mike Montour, who has been a huge part of the emergency control group in the planning of exactly how this is going to all roll out in terms of our checkpoints.
Welcome, Mike.
Thanks for having me. So, more details on what we're going to be doing as far as the overall closure looks. So, basically, we're getting a lot of questions in regards to, what about I'm coming from the community to get my dialysis treatment or a medical appointment, or I need to work because I live off reserve. There's all kinds of different scenarios. We'll just make it very simple. So if you're here for shopping or recreation, you're going to be asked to turn around. That's as simple as we can make it. I'm not going to go through the scenario by scenario by scenario. If you're here for shopping or recreation, you're in that line. We're going to have people there asking you, please turn around out of respect for our community. Because, again, just piggybacking on the serious message that Mark had is that this virus moves with the people. The people stop moving. You stay home. You do what you need to do, and we've done as far as the best we can to support people stay home and having that peace of mind, saying, you know, I don't need to worry about water, I have that free, I don't worry about septic, I have that free. So you're seeing this is an unprecedented time. These steps are unprecedented. We're coming up with all this stuff from scratch. And that's because that reflects the seriousness of this. And don't let it come to a point where it affects someone you love for it to really sink in and say, you know what, I should have listened, I should have stayed home, because we wouldn't be doing this if it wasn't about life and death. And that's exactly what this is about. So people need to listen to this message. We're going to have 8 entry points. There's going to be a map that's going to be circulated. And we're getting calls in regards to, you know, I want to volunteer for security, or I want to look at trying to be a part of helping. And so I would say to that, if you're interested in that, please call Mike Player at Nighthawk Security. His number is 519-755-0591, and he'll put you on a roster. He'll talk to you, and you can figure that piece out. Also, a call out to all the local businesses in regards to even PPE. So if you have any kind of masks or anything that you could provide to assist us, because this, as you've just heard, we have our 2 first positive cases, and at some point this is going to be passed down to our frontline workers. So your firefighters, paramedics, and everybody that's gonna leave their families to help protect yours. They need personal protective equipment, and if you have it at home, please donate it. Please contact me. You can contact me at the Public Works Office, 519-445-4242, and I would love to be able to have that, because if you look at it regionally, I'm sure everyone's reading the articles out there. There's hospitals are running short on PPE. They're asked to stretch it, and we don't want to get in that situation. So if you can contribute in either of those ways, please do so. But the main thing we're asking people to do is stay home. Stay home unless it's absolutely necessary for you to get out. And I can't stress that enough, because I speak on behalf of all your frontline services and your emergency control group when I say we haven't seen our kids or spent time with our families since this started. I don't know, 2 or 3 weeks ago. I don't even know what date it is. Some of us I'm in my sweats. It's not about looking professional, because we're run down, we're tired. We want to go home to our families, and the only way we can do that is if everybody stops and takes this message seriously and stays at home. We don't want to be giving emergency treatment or anything to everyone, but people are gonna find their courage, and people are gonna be out there, and I commend those people, because those guys are true heroes.
I would also just like to add and further recognize the Haudenosaunee Confederacy chiefs and clan mothers in their support in the emergency control group's efforts and next moves. Again, I believe it's time again to set all differences aside and just be there for each other and protect our community.
Indeed. Thank you very much, Mark.
Thank you.
Six Nations